Our department is amazing because it's hugely diverse, has incredible scopable scholarship, teaching, and clinical work. There are about 55 residents in our program at any given time. Over those 3 years, you're going to do everything, right? You're going to do a few months of cardiology, a few months of ICU, a little bit of hem-onc, a lot of general medicine wards. So you're just going to experience kind of the full breadth of what internal medicine training should be.
We have 3 tracks in our program. Preliminary track, which is for interns going into different residency programs other than internal medicine, the categorical track, and we also have a primary care track. These residents have 6 weeks per year on their schedule to explore more outpatient medicine topics or spend more time in clinic.
We're a large tertiary academic center with all of the subspecialties and a huge catchment area.
We have over 1 million people who use our place. And so that means we get both the sort of bread and butter things that you do every day, and we get the more unusual, more complicated cases from around our area.
The pinnacle of healthcare in Vermont is right here. And so everything that's happening on the medical forefront in the state is here. And so it gives us a lot of opportunities for population health. We see that longitudinal care and we see that care across the entire population that we work for.
From day one, when you get here, UVM does a great job of exposing you to as many things as possible.
Most all of the faculty are really clinical educators and interested in making sure the residents have the best experience.
The balance that you get here, I think, is second to none. And that really shines through when you're rotating on services with attendings, when they actually take the time to get to know you and really tailor the experience.
I'm interested in pulmonology and critical care, so I was really interested in some of the research that had already come out of this institution and some of the individuals here that are kind of at the top of the field. And so I was wondering whether or not I'd actually interact with them, if I'd have opportunities to research with them. And they come to Noon Conference, they teach us, they interact with us, they're very enthusiastic about getting even interns involved with research.
Everyone is so incredibly happy to help you out. So when I was on nights, I had a patient who was maybe not doing so well on the general medicine floor, and I was concerned that maybe they might need to step it up and go to the ICU. I know all the ICU fellows, and so I could just call them even at 3 in the morning.
I have research opportunities if I want to pursue those. It's something that was important to me. But just getting into having a chance to play a role as a teacher, as a mentor, also being really actively involved in research, it was like the whole package just made a lot of sense for me.
I started off in cardiology, which can be pretty intense, but at the same time, I was surprised about how much free time I was able to get. Once you finished your work, you were able to turn it over and get out, and it just felt like this really unexpected balance of being able to get a little free time. It was just this, impressively nurturing mentality.
People have a passion for teaching. People really want you to get ahead. If I had a nickel for every time somebody stops what they're doing and start teaching me something, that is for sure the best thing about UVM.
When it comes to the concrete education, I think there are a lot of similarities in programs. So I think you have to kind of look at the next step. Who are the people that I'm going to be working with? Do these people feel like my people? Do these people feel like my friends and my colleagues? Is this a place that I can see myself thriving in, both personally and professionally? And can I tolerate cold winters?
They make you feel heard and cared for. The environment here is collegial and also respectful at the same time. And the chiefs here, they bring you candies every time.
Being at work here is fun. We really form relationships with each and every resident here. So it really does foster an environment of being at work with your friends.
UVM is really unique in that it draws people in who want to be at an academic facility and who want to practice high-level medicine and provide quality care in a place that is just a great place to live.
The one thing I can guarantee is, if you come to University of Vermont, you're going to be supported by all these levels of people, and that is just truly unique and remarkable. And it's some of the best people I've ever met anywhere in my lifetime.
I just fell in love with the place. Everyone is so competent, everyone is so super smart, yet so humble. And that combination is, I believe it's very hard to find.
Vermont feels sort of like a second home. When I came here initially, just captured my heart. It is so beautiful. The residents are so happy here and more balanced.
You had the benefits of being small and personable and supportive while also having the resources of a university program and a huge catchment area to have some diversity in the patients. Really, that kind of shone through during the interview process for me that this was somewhere I would fit in and feel supported and have a good time, and that's exactly what I've had.
I can't say enough about what our culture has done for my medical training here. Yeah, I think it's so important. I wish that everybody could just experience it.
I was 7 oceans away in India, Delhi, but when I talked to the people here on Zoom, it felt like we were having a face-to-face conversation. I felt like I wouldn't even just enjoy the work here, but I would enjoy the company of the people here. And that's why UVM was my top choice.
We're really excited to meet the medical students who are interviewing at our program this recruitment season. We're sorry we can't see you in person, but we are really looking forward to these virtual interviews with you and telling you all about our program. We wish you the best of luck during your virtual interview experience.